let's dive right into this explainer. Today we're tackling the top 10 questions patients ask the spine care team over at Vertrae in Dayton, Ohio, all about the ReActiv8 procedure. If you've been dealing with chronic mechanical lower back pain, you've probably done a ton of research. But actually picking up the phone to ask those big questions, that can feel incredibly daunting. Well, Jen Leibold, PAC, and Dr. Kamal Woods handle these exact questions every single day, so we're going to unpack their answers right now. Before we even get into the clinical facts, it really helps to address the hesitation so many folks feel. Take a look at this quote from a real patient in Beaver Creek, Ohio. It perfectly captures that massive wall of doubt, the fear of insurance battles, and honestly, just the sheer exhaustion of trying everything else. It's a very real, very valid fear. But bringing these fears out into the light is step one toward finding actual relief. To demystify this whole therapy, here's our agenda. 1. Procedure and recovery. 2. Results in daily life. 3. Why it's different. And 4. Logistics and coverage.
Moving right along to Section 1, Procedure and Recovery, Dispelling the Fear.
Patients always ask Jen Leibold and Dr. Woods these two immediate questions about the big day. And it makes sense, right? Your imagination starts running wild, picturing massive surgery and days stuck in a hospital bed. But the reality is actually remarkably different. So, here is the absolutely crucial point. This is not major spine surgery. You come in, you go under comfortable IV sedation with local numbing medication. That means absolutely zero general anesthesia is required, which significantly reduces your risk right out of the gate. Leads are then placed using live X-ray guidance at 2 highly specific points in the lower back, right next to the L3 transverse processes. The incisions are incredibly small, and you go home the exact same day. The whole thing happens at the spine-exclusive Vertrae Surgery Center in Miamisburg. It's completely an outpatient experience. Okay, so now you might be wondering, what happens next? Let's look at how quickly you transition from that initial post-procedure soreness to an active, individualized recovery plan based on your specific job and lifestyle. For those first few days, you're going to have some soreness at the incision sites, and you really just need to rest. No bending, twisting, or lifting. Then, between days 3 and 14, you'll gradually return to light activity. Now, here's the kicker. During this whole time, the device actually stays off while you heal. This allows most folks with desk jobs to get back to work within 1 to 2 weeks. Now, if your job is physically demanding, Dr. Woods and the team will give you individualized guidance for a slightly longer recovery. But day 14, that is the milestone. That's when the device is officially activated and your therapy truly begins. Let's transition to Section 2, Results and Daily Life. The restorative trajectory. Everyone wants an immediate fix, right? With chronic pain, we're so conditioned to expect a shot or a pill to just work instantly. But ReActiv8 is completely different. It's actually restoring a muscle, the multifidus muscle that has been shut off for years. And quite simply, rebuilding that neuromuscular control takes some time. Most patients actually begin noticing a real difference around the 3-month mark. And what's amazing is that the upward trajectory continues for years. At 3 years out, a staggering 83% of patients show substantial improvement. 5-year longitudinal data even shows that these outcomes don't decay over time. They just keep improving through 6 to 12 months and well beyond. That is an absolute rarity in chronic pain medicine, where treatments usually just plateau or wear off as your body builds a tolerance. Next up, patients naturally worry about what everyday life will look like. Are you tethered to a machine all day? Or maybe you're worried about making a huge, irreversible mistake that permanently alters your spine. In reality, this therapy is incredibly minimally intrusive. Your daily routine consists of just 2 30-minute sessions using a small, handheld, wireless activator. You could literally do it while drinking your morning coffee or watching a show at night. There are absolutely no external parts you have to wear. And get this, there is 0 sensation during stimulation. No tingling, no buzzing. That's because it activates a motor nerve, not a sensory pathway. Once you're fully healed, you can get back to most activities like swimming, exercising, and traveling. And perhaps most importantly, if for some reason it doesn't work for you, it is completely reversible. The device can be removed in a simple outpatient procedure, and nothing about the structural architecture of your spine has been permanently changed. That's a vastly different situation from traditional surgery.
All right, Section 3, Why it's different, bypassing the blockers.
This is the question where patients tend to carry the most guilt. So many folks incorrectly assume that just because physical therapy failed to fix their back pain, it was somehow a personal failure, like they just didn't try hard enough. But let's look at the mechanics here. Physical therapy relies entirely on voluntary muscle effort. You have to consciously try to engage those muscles.
But in patients dealing with chronic mechanical back pain, the multifidus muscle has been reflexively shut off at the spinal cord level. It is literally beyond the reach of your conscious control. ReActiv8 bypasses that broken voluntary pathway entirely by directly stimulating the motor nerve. So physical therapy not working is not your fault. It's just a mechanistic limitation, and ReActiv8 was specifically designed to overcome it. Because both of these options involve an implant, patients frequently confuse the two therapies. So the Vertrae team focuses really heavily on establishing this critical difference because honestly, they treat entirely different problems. Spinal cord stimulation, or SCS, is designed to mask radiating, burning nerve pain, like the kind of pain that shoots down your leg after a prior back surgery. ReActiv8, on the other hand, targets the motor nerve to physically restore a muscle that simply stopped working. It is specifically meant for mechanical back pain in patients who have not had a prior spine surgery. So it's a completely different mechanism, a different nerve, and an entirely different patient. And finally, Section 4, Logistics and Coverage, taking the next step. Just like the quote we saw at the very beginning of this explainer, most people assume the answer here is a flat no before they even bother to check. And sadly, that assumption stops them from ever picking up the phone to get evaluated. But the reality is actually incredibly encouraging. Medicare and many commercial insurance plans do cover ReActiv8 for qualifying patients. And the best part? You don't have to fight that battle alone. The Vertrae team handles all the insurance verification and prior authorization before anything is ever even scheduled. They make the calls, they check your specific coverage, and they do it all in a completely zero-pressure environment. So we've walked through the procedure, the recovery timeline, the restorative science, and the logistics. All the facts are right here on the table. Dr. Kamal Woods evaluates every single candidate personally to determine if this is the right path for your specific pain. So are you ready to stop letting unanswered questions and assumptions keep you in pain and instead start a real restorative conversation with the spine care team at Vertrae? Visit Vertrae.com to schedule your motion first evaluation. And I'll leave you with this final thought. If your chronic back pain is being caused by a muscle that simply forgot how to function, isn't it about time you finally turned it back on?